Before we dive in, don't forget to like, subscribe, and hit the bell icon for more health tips. Picture this. You're all dolled up for a hot date. You've got your best outfit on, hair did, and makeup flawless. You're feeling like $1,000,000. But then, as you lean in for a hello hug, a faint fishy odor wafts up your nose. Aish! Suddenly, you're questioning everything. Is it you? Is it him? Is it that tuna sandwich you had for lunch? We've all been there, ladies. Those awkward moments when our bodies decide to throw us a curveball. But what if I told you that fishy smell could be a sign of something more common than you think? Something easily treatable? Intrigued? Read on, my friend. That not so pleasant experience I just described, you know, the one that makes you feel uneasy and uncomfortable down there. It could be more common than you think. It could very well be bacterial vaginosis, or BV for short. BV occurs when there's an imbalance in the natural bacteria found in the vagina. This imbalance can lead to symptoms like unusual discharge, odor, and discomfort. Don't let the name scare you though. BV is quite treatable and manageable with the right approach. Many women find relief through simple treatments and lifestyle adjustments. BV is not a sexually transmitted infection. It's a common misconception, but rest assured, you didn't get it from sexual activity. It's all about the balance of bacteria. It's actually the most common vaginal condition in women of childbearing age. In fact, studies show that nearly 1 in 3 women will experience BV at some point in their lives. So, if you've ever experienced it, you're definitely not alone. Many women have gone through it and come out the other side feeling much better. Now, I know talking about vaginal health can be a bit, shall we say, sensitive. It's a topic that many shy away from, but it's crucial to bring it into the open. But trust me, this is important stuff. Understanding our bodies and how they work is key to maintaining good health and well-being. We need to break the stigma surrounding these topics and get comfortable discussing our bodies. Open conversations can lead to better health outcomes and a stronger sense of community. After all, knowledge is power. The more we know, the better equipped we are to take care of ourselves and support others. What do you think? Have you ever experienced anything like this before? Your experiences and insights could help others who might be going through the same thing. Share your thoughts in the comments below. Let's create a supportive space where we can learn from each other and grow together. To understand BV, you need to understand the delicate ecosystem that is your vagina. It's a complex and dynamic environment, much like a finely tuned orchestra, where every instrument plays a crucial role. Think of it like a rainforest, teeming with different types of bacteria. Each type of bacteria has its own function, contributing to the overall health and balance of the ecosystem. Some of these bacteria are good guys, like the lactobacilli that produce lactic acid, keeping your vaginal pH nice and acidic. This acidity is a natural defense mechanism, creating an environment where harmful bacteria struggle to survive. This acidity is crucial for preventing the overgrowth of harmful bacteria. When the pH is balanced, it acts like a security system, ensuring that only the beneficial bacteria thrive. But sometimes, this delicate balance can be disrupted. Factors like antibiotics, hormonal changes, or even stress can tip the scales, making it easier for harmful bacteria to take over. When that happens, the bad bacteria, like Gardnerella vaginalis, can multiply out of control, leading to, you guessed it, bacterial vaginosis. This overgrowth can cause symptoms like unusual discharge, odor, and discomfort. It's like a party where all the well-behaved guests suddenly leave, and the rowdy ones take over. The once harmonious environment becomes chaotic and disruptive. Not exactly the kind of party you want happening down there. Maintaining this balance is key to vaginal health, and understanding it is the first step in preventing and managing conditions like BV. So, how do you know if you have BV? Well, that fishy odor I mentioned earlier is a big giveaway, but it's not the only symptom. Other signs to look out for include a thin, watery discharge that might be white, gray, or even green, itching or burning around the vaginal opening, pain or discomfort during sex. Now, I know some of these symptoms can also be signs of other conditions, like STIs. That's why it's so important to see your doctor or gynae for an accurate diagnosis. Don't try to self-diagnose or self-treat. Have you ever experienced any of these symptoms? It's time to get real about our vaginal health, ladies. Section 5. Treating the imbalance. The good news is that BV is usually pretty easy to treat. Bacterial vaginosis, or BV, is a common condition that many women experience at some point in their lives. It's caused by an imbalance of the natural bacteria in the vagina. While it can be uncomfortable and sometimes embarrassing, the treatment is straightforward and effective. Your doctor will most likely prescribe antibiotics, either in pill form or as a vaginal cream. These antibiotics work by targeting the harmful bacteria causing the imbalance. The type of antibiotic and the duration of the treatment can vary depending on the severity of the infection and your medical history. It's super important to finish the entire course of antibiotics, even if your symptoms clear up before then. Stopping the medication early can lead to a recurrence of the infection, and it might become more difficult to treat. Completing the full course ensures that all the harmful bacteria are eliminated. This helps to ensure that the infection is completely gone and doesn't come back. Your healthcare provider will give you specific instructions on how to take the medication, and it's crucial to follow these guidelines closely. Now, I know what you're thinking, antibiotics, but those kill all bacteria, good and bad. It's a valid concern because antibiotics don't discriminate between harmful and beneficial bacteria. And you're right. But don't worry. Your vagina is a resilient little ecosystem. It has the ability to restore its natural balance over time. Your body is equipped to handle this temporary disruption. It'll bounce back. In the meantime, you can help things along by wearing cotton underwear and loose-fitting clothes to allow for airflow. These choices help keep the area dry and reduce the risk of further irritation or infection. Avoiding douching as it can disrupt the natural balance of bacteria in your vagina. Douching can actually make things worse by pushing harmful bacteria further up into the vagina and washing away the good bacteria that help keep infections at bay. And using mild, unscented soaps when washing down there. Harsh soaps and scented products can irritate the sensitive skin and disrupt the natural pH balance of your vagina. Stick to gentle, fragrance-free products to maintain a healthy environment. If you have any concerns or questions about your treatment, don't hesitate to reach out to your healthcare provider. They are there to help you through this process. And remember, taking care of your health is a priority. Schedule regular checkups and stay informed about your body. Section 6. Sharing is caring. Your experiences matter. Let's face it, ladies, we've all had those embarrassing health moments. But the more we talk about them, the less alone we'll feel. So tell me, have you ever dealt with BV? What helped you feel better? Share your experiences in the comments below, and let's support each other. Remember, there's no shame in talking about vaginal health. It's a normal part of being a woman, and the more we know, the better equipped we are to take care of ourselves. Section 7. Beyond the symptoms, the emotional toll. It's easy to focus on the physical symptoms of BV, like the odor and discharge. But let's not forget about the emotional impact these symptoms can have. Feeling self-conscious about your body can really put a damper on your confidence, intimacy, and overall well-being. If you're struggling with the emotional side of BV, please know that you're not alone. It's important to reach out for support, whether it's from your partner, a friend, or a therapist. Talking about how you feel can make a world of difference. Section 8. Taking charge of your vaginal health. The good news is that there are things you can do to help prevent BV from recurring. Here are a few tips. Practice good hygiene. Wash your genital area daily with mild, unscented soap and water. Wipe from front to back after using the toilet to prevent the spread of bacteria. Avoid douching and using feminine hygiene products that contain fragrances or irritants. Use condoms consistently, especially with new partners, to reduce your risk of exposure to harmful bacteria. Remember, your vaginal health is an important part of your overall health and well-being. By taking care of your vagina, you're taking care of yourself. Section 9. Up next, the itch unveiled. So we've tackled the fishy smell of BV, but what about that other common vaginal woe, itching? Stay tuned for our next installment, where we'll be diving deep into the world of vaginal itching causes and remedies. Trust me, you don't want to miss it. Section 10. Join the conversation. Knowledge is empowering. Don't forget to hit that subscribe button so you don't miss out on any of our future videos. And be sure to share this video with your friends, sisters, mothers, aunties. Let's spread the knowledge and break the stigma surrounding vaginal health. Remember, ladies, knowledge is power. The more we know about our bodies, the better equipped we are to take care of ourselves. So let's keep the conversation going in the comments below. What are your biggest questions about vaginal health? Let's chat. And don't forget to like, share, and hit the notification bell to stay updated with our latest content.